Welcome to MitoCast by Mito Foundation. We share information and resources to support people with Mito, their families, and the wider community. All content is created by Mito Foundation. AI text-to-voice technology is used only for the production to make our resources easier for everyone to access.
Take a second to imagine that you are looking at your phone or trying to read a street sign, and the center of what you are seeing starts to blur. Not a little squinting blur, not a headache blur. A patch right in the middle that makes words fall apart. For some people, that kind of sudden, painless central vision loss is how Leber, hereditary optic neuropathy, begins.
That sounds strangely specific. Central vision is only impacted, not the whole picture we see?
Exactly. Leber hereditary optic neuropathy, most commonly known as LHON, is a rare genetic condition, and it is one of at least 350 known types of mitochondrial disease. Mito, for short. LHON is often talked about as a condition that impacts the optic nerve, the pathway carrying visual signals from the eye to the brain, and it can lead to vision loss.
I have heard Mito before, but I do not always feel confident explaining it. How does Mito connect to vision?
Mito affects mitochondria, which are tiny structures inside most of our cells that use food to provide the energy the body needs to sustain life. When mitochondria cannot produce the energy your body needs, organs cannot function properly. And because parts of the nervous system and the eyes are so energy hungry, they can be especially vulnerable in some types of mito, including LHONs.
So LHON is sort of a specific type under that umbrella?
Yes, and LHON has a pattern that people often describe in similar ways. Central vision loss that can happen without warning or discomfort. It typically starts in one eye. Then the other eye may lose vision within weeks, months, or even up to a year later. And while that can be life-changing, most often a person with LHON does not go completely blind. Central vision can be lost to varying degrees, but peripheral or side vision remains.
When you say central vision, do you mean like the part you use to read and recognize faces?
That is a good way to picture it. One of the early signs can be a small, blurry spot in or around the center of vision called a scotoma, which is a patch where seeing clearly is difficult. On the LHON pathway, that spot can expand and then stabilize, and the loss is typically sudden and painless. People often say the eyes can look healthy at first, even while the signal to the brain is not getting through properly.
And you mentioned the optic nerve. Can we slow down and explain that in plain language?
Absolutely. Think of the optic nerve as the cable carrying messages from the eye to the brain. In LHON, the issue is not mainly about how the eye focuses light. It is about how well those messages travel along that cable. That is why LHON can be so confusing at first. Someone can look like their eyes are fine, but their central vision is changing quickly.
This is where people probably ask, so can I just get new glasses?
Perfect moment for a quick myth and fact. Myth, a stronger glasses prescription, will fix or stop LHON vision loss. Fact, glasses help the eye focus light properly, like when someone is short-sighted or long-sighted. But LHON affects the optic nerve, the connection to the brain. Because the messages are not getting through properly, glasses usually do not help improve or stop the vision loss.
That is blunt, but it also helps to know what not to pin your hopes on.
And it makes room to focus on what can actually help, support, aids, and adaptive technology to make the most of remaining vision, plus the right care team. It is also worth naming that LHON can, in some individuals, affect other parts of the nervous system. When that happens, it may be referred to as LHON plus.
And something that can throw people off is the naming. You might hear someone say, I have LHON, and then someone else says, you have mitochondrial disease, or a report shows a technical code that does not look like either of those. How can all of that be talking about the same thing?
It helps to think of Mito as the umbrella, and LHON as one specific type under that umbrella. And then, on top of the umbrella and the specific type, there are different layers of diagnosis that can use different language. What a clinician can recognize from your symptoms and examinations over time, what non-genetic tests might show, and what genetic testing can confirm.
So someone could start out being told, this looks like Mito, and later get told it's LHON once testing points to that specific pattern?
Exactly. A clinical diagnosis is based on symptoms, health history, and an examination. A biochemical diagnosis is based on non-genetic tests. And a genetic diagnosis is when genetic testing confirms a specific type by identifying a genetic change. Those layers can arrive at different times, so the names can shift as the picture becomes clearer.
And within LHON itself, people might also hear slightly different wording in clinic notes, like Leber's optic neuropathy or optic atrophy, even if they have been saying LHON day to day.
Yes. And then a genetic report may add a very precise label, like a code for the specific genetic change found. That code is not meant to replace the condition name in conversation. It is simply a detailed way of describing the underlying genetic finding that sits underneath the diagnosis.
That actually makes it feel less messy. It is not that people are being told different stories. It is that the same story is being described at different levels.
Exactly.
And once those names make more sense, the next questions people often ask are, who tends to be affected and how common is it?
There is a typical range, but there is also a lot of variation. People are often affected in young adulthood. Vision loss is commonly described between ages 15 and 35, but it can occur at any age and affects both men and women. The pattern of who is more likely to lose vision is not even between sexes either. Vision loss affects males about 4 times more often than females. And LHON is more common in males who are more likely to lose vision.
Okay, I want to ask a numbers question, but I also do not want this to become a statistics episode.
We will keep it grounded and relevant. LHON is rare, but it is also described as one of the more common types of Mito. It affects around 1 in 45,000 people worldwide, and in 2020, it was reported to affect 1 in 68,403 people in Australia. Large population studies from the United Kingdom and Australia also show that at least 1 in 1,000 people carry one of 2 common LHON genetic changes. And not all people who carry a genetic change will develop symptoms.
So you can carry the genetic change and never lose vision?
Yes, and that can be emotionally complicated in families. The way LHON is inherited is also specific. LHON is a genetic condition most commonly caused by changes in mitochondrial DNA, and it is inherited from the mother. That means males with the LHON genetic change cannot pass it on to their children. Females with the LHON genetic change will pass it on to all of their children, regardless of whether they are sons or daughters. But again, not everyone with the genetic change will develop vision loss.
That is the part that makes family conversations feel so heavy. Passed on sounds like certainty, but the symptoms are not certain.
Exactly. The resources describe a mother with no signs and symptoms who carries the genetic change as a genetic carrier. All her children inherit the LHON genetic change, but that does not mean they will lose vision. Among LHON carriers, it is described that 1 in 20 females and 1 in 6 males lose vision. And Australian LHON research also notes there are some families with higher or lower risk, and that predicting who will develop symptoms and how severe they will be can be difficult.
When people hear 1 in 6, they might panic. But then you also said most carriers will never lose vision.
Both can be true, and it is why nuance matters. Risk can be real, and uncertainty can still be the dominant experience. And it is also why genetic counselling comes up repeatedly as a support, not just for facts, but for decision-making and coping.
Before we go there, can we talk about what the vision loss actually looks like? People might be trying to compare it to their own experience.
The LHON descriptions focus on central vision loss as the typical symptom, but they also explain it with a few practical markers. Blurriness is often the first symptom. It starts with that small, blurry spot, the scotoma, and then vision loss may affect both eyes within months. Another marker is visual acuity, which is the clarity of vision, your ability to recognize small details. It is often measured at a distance of 6 meters and expressed as a ratio, like 6/6 for typical vision.
And what does it mean when that ratio changes?
In LHON, vision can differ from person to person, but it is often around 6/60 or worse. That means a person sees at 6 meters what should be visible at 60 meters. Some people can only see hand movements or light. The resources also explain legal blindness in Australia. A person is legally blind if they cannot see at 6 meters what someone with normal vision can see at 60 meters, even with glasses, or if their field of vision is very narrow, less than 20 degrees wide.
Legally blind does not always mean total blindness, right?
Right. And that is another important fact to hold on to, especially for people newly adjusting. Being legally blind does not always mean total blindness. Many people with LHON retain peripheral side vision. That does not erase the challenges, but it changes what support and adaptation can look like.
You used another term earlier, optic atrophy. What is that in everyday language?
Optic atrophy is optic nerve damage, meaning the optic nerve degenerates over time. The optic nerve carries signals from the eye to the brain, so when it is damaged, the message pathway is affected. A person can have a normal eye examination initially and in the early stages, which is one reason early symptoms can be missed or misunderstood. The resources also note that although vision loss is often permanent, some people may recover some vision over time, and vision recovery is more common in those with a particular LHON genetic change, especially when affected at a young age.
So the story is not always one-directional, but we cannot assume recovery either.
Exactly. It is a some people statement, not a promise. And that balance is a theme across LHON information. There are patterns, but individual experience can vary.
What about triggers? People always ask, why now?
LHON resources describe potential risk factors that some research suggests may contribute to the onset of vision loss. These include smoking, tobacco, alcohol consumption, certain prescription medications, illicit medication use, and environmental toxins. And there is a practical caution embedded in that. If you are at risk of LHON vision loss, check with your health professional before taking medications to consider benefits and risks. The resources also point to an important information about medicines page that includes a list of potentially problematic medications.
That is a strong reminder not to self-manage medication changes.
Yes, the safest way to use that information is as a prompt for a conversation with a qualified health professional who knows your situation. Alongside that, there are lifestyle recommendations given in plain language. Limit alcohol and avoid smoking, as both can increase the risk of vision loss. They also mention maintaining a healthy lifestyle, including eating a balanced diet, staying active, and using eye and head protection during sports and recreational activities whenever possible, and avoiding high-risk activities like boxing.
That is concrete, and it is not framed as this will fix it, but as reducing risk where possible.
Exactly. Now, let us move into diagnosis because what is happening and what is it called can be two separate, stressful timelines. A diagnosis for LHON is based on your history, signs and symptoms, physical examination, and other testing. The physical exam includes assessing vision and eye health, and tests can include visual acuity, visual field testing for peripheral vision, and a color vision test.
I have heard people talk about eye drops and cameras and scans. Is that part of it?
It can be. The resources mention ophthalmoscopy, also called fundoscopy, which requires eye drops to open the pupils so a health professional can examine the lens, retina, optic nerve, and nearby blood vessels. They also mention optical coherence tomography, or OCT, which is a non-invasive imaging method creating detailed pictures of the back of the eye, the retina, and helping measure thickness of the retina and optic nerve. And they mention magnetic resonance imaging, an MRI, which is a non-invasive imaging method that takes pictures to help explain why vision is reduced.
So there can be a lot of testing, even though the problem is not a glasses problem.
Yes. And then there is genetic testing, which is a key piece in LHON. If a doctor suspects LHON, they may arrange genetic testing from a blood or saliva sample to look for genetic changes associated with the condition. The resources state that the LHON genetic change is found in mitochondrial DNA. They also note that genetic testing is highly specialized and may take up to 3 to 4 months to receive results, and that genetic counseling is important to discuss what results mean for you and your family.
3 to 4 months is a long time when you're scared.
It is. And that is one reason support services matter while you are waiting. It is also why it can help to think of care as more than diagnosis. If you have LHON, you will likely need a team of health professionals. The resources list a general practitioner as a main point of contact who can help with referrals, tests, and coordinating care. They also list neurologists, ophthalmologists, neuro-ophthalmologists, low vision specialists or orthoptists, genetic counselors, occupational therapists, and mental health professionals.
That is a big team. How do people even know who to see first?
Often it starts with whoever you can access quickly, and then that person helps you build the path. The recommended care section for LHON includes a simple first step. Visit an eye care provider and share your medical history and your family's medical history. If symptoms are related to your diagnosis, they can refer you to an ophthalmologist for a comprehensive exam if needed. And referrals to a low vision specialist are recommended for people with LHON because low vision specialists can provide tailored support and assistive devices.
I like that phrasing, tailored support. It implies it is not one size fits all.
Exactly. And ongoing monitoring is framed as a conversation. Discuss ongoing monitoring with your ophthalmologist. They may recommend annual visits or appointments when needed. Those visits may involve checking for changes in vision, assessing the health of the retina and macula, measuring pressure inside the eye, and evaluating the health of the optic nerve. One adult living with LHON put it plainly: keeping up with regular eye checks can catch other eye symptoms early and help protect the vision they still have.
So even if LHON itself is not fixed, there can still be other treatable issues you want to catch.
Yes, it is a protect what you can approach. And now we should talk about immediate support, because this is where people often need practical help fast, not just long-term planning. The resources point to vision rehabilitation organisations throughout Australia, such as Vision Australia and Guide Dogs Australia, that can provide valuable support and services. They note everyone experiences blindness or visual impairment differently, and that support services can often be tailored.
What kind of services are we talking about day to day?
They list examples: orientation and mobility training, which is learning how to move safely and confidently in different environments, maintaining independence around your community, home, school, and workplace, and technology assistance. They also point people towards the Foundation's helpline for more information about services in your area.
And there is also disability support, like the National Disability Insurance Scheme.
Yes, The resources describe that the National Disability Insurance Scheme, the NDIS, provides funding and support for people who are vision impaired. They also describe an NDIS navigation service run by the Foundation. This service can help you apply for long-term support.
I want to be careful here because people can get overwhelmed by the NDIS very quickly.
That is honest. The NDIS navigation service is described as free and independent, run by the Foundation to support people living with Mito, and they are clear that the service is not part of the NDIS or the government. They describe supporting people who are new to the NDIS, applying, or who already have a plan, to help them navigate. They also describe a reality many people feel. Mito is rare and can look different for everyone, and people working in the NDIS may not know much about Mito, so support can include helping you explain how it affects everyday life.
So it is not just forms, it is also translating your lived reality into language decision makers can understand.
Exactly. And the NDIS information is also clear about the big picture. The NDIS may provide funding for people with a permanent and significant disability that affects daily life. It may fund things like support workers to assist with daily tasks, therapy services, equipment or assistive technology, and home modifications or transport support. An NDIS plan lists the types of support funded to help you work towards goals.
And it also will not fund some things, right?
Right. The NDIS funds supports that are related to your disability, likely to help you live more independently and considered reasonable and necessary. It will not fund everyday costs that everyone must pay, things the health system should cover like hospital visits or medication, support for education like teacher aides or learning adjustments, or anything not related to your disability.
That is helpful to hear in plain language because people can waste so much energy asking for the wrong category of help.
Yes, and the NDIS navigation service outlines the kinds of help they can provide. Understanding how the NDIS works, identifying needs and goals, collecting and understanding supporting evidence, applying, preparing for planning meetings, reviewing or updating plans, understanding letters and decisions from the agency, exploring options if you do not agree with a decision, and connecting with trusted providers who understand Mito.
This is where you said we have an extra resource, right? The information sheet specifically about NDIS assistance for LHON.
Yes, and I want to name it clearly. The Mito Foundation information sheet is called NDIS Assistance for LHON. There are specific tips that can make the process smoother for people with LHON, especially because decision makers may not be familiar with it or understand how it affects day-to-day activities. It says a compelling letter from your ophthalmologist can improve decision makers' understanding of LHON.
What are the tips? People love a checklist when they are stressed.
Start with a third-party consent form, which lets the NDIS talk to your chosen support network. It also emphasizes getting a support letter from your ophthalmologist, including your specific eye condition, your visual acuity, and your visual field changes. It notes there is a template letter developed through collaboration between the Foundation and LHON experts from the Centre for Eye Research Australia, designed to help your ophthalmologist include relevant information.
And there were some very practical phone tips too, right?
Yes. The information sheet suggests that at a pre-access meeting, you can ask for a priority eligibility decision. It also suggests updating your voicemail to include your full name, because the NDIS may not leave messages if they cannot confidently identify someone from voicemail. And if someone from the NDIS calls you, ask for their name and contact details, because you may need to call them back. And the NDIS will often call from a private number.
That is the kind of advice that feels almost silly until you have missed 3 calls and everything is delayed.
Exactly. And the information sheet also encourages seeking support from family, friends, or groups, like Vision Australia, Guide Dogs, or the Foundation, because this process is hard to do alone when you are already managing vision loss.
Let us talk more about that compelling letter, because it sounds like the hinge point.
The information sheet is very specific. It says the letter should explain LHON and show proof of your diagnosis, and include your diagnosis of LHON, that you have permanent and lifelong vision loss. Details of your vision loss, including visual acuity, and whether it is less than 6/60, and or whether you are legally blind, information about both eyes, and that there is no proven cure or treatments available. It also says to include the functional impact on your life, like impact on driving, work, study, or completing daily activities.
And it also asks you to connect the dots to what you need.
Yes, the letter can include what support you might need, such as allied health assessments like occupational therapy or psychology, assistive technology assessments, orientation and mobility training, home modifications, and a support worker to support access to transport, community, recreational activities, and more.
That is actually empowering. It gives people permission to talk about function, not just diagnosis.
Exactly. And that is consistent with the broader NDIS messaging. It is about how disability affects daily life and goals. The NDIS navigation service also describes how to access their support. You can call the helpline or fill out an online form. Then a member of the helpline team contacts you to understand your needs and offer initial support. And if needed, they refer you to the NDIS navigator for more personalized guidance.
I know not everyone will be eligible for the NDIS, or not everyone will get what they ask for. What else is mentioned for support?
The LHON resources also include a checklist of other funding options that may help people with LHON outside of the NDIS, and it is careful in its wording. Not every option will apply to everyone, but it is worth considering each one carefully, and to take your time exploring what might suit your situation. It mentions options like the Disability Support Pension, the Pensioner Education Supplement, the Companion Card, travel concessions, mobility allowance, parking permits, an assistive technology program, and notes that some private health insurance policies may help pay for vision, aids, or therapy.
So the message is there are multiple doors and you do not have to sprint through them all at once.
Yes. Now, we should also talk about treatment, because people will hear the word genetic condition and immediately ask, what can be done medically? The LHON resources are direct. There is currently no cure for LHON. Treatment focuses on making the most of remaining vision through support, aids, and adaptive technology. They also say low vision rehabilitation can be a practical and cost-effective way to adapt to vision loss, supporting quality of life, independence, and daily activities.
And research?
Research into new treatments is described as ongoing, but the resources caution that none have been proven to be safe or effective. They say while some options show promise, more research is needed to confirm benefits. They also warn that new or experimental treatments must be considered cautiously and encourage talking to your health professionals before trying them.
That feels like the right kind of caution, especially when people are desperate.
It is. One area discussed is antioxidants and a medication called idebenone. The resources explain idebenone as a synthetic medication similar to coenzyme Q10, and the theory is it may help cells make energy. They explain that idebenone can act as an antioxidant, which is a substance that may protect cells from damage. And they mention free radicals, harmful substances that can damage cells.
Do they say it works?
They say the effectiveness of idebenone has not been robustly proven and more research is needed. They also say idebenone has shown benefits in clinical trials for LHON, but response can vary based on genetic factors and the stage of the condition. They describe idebenone as thought to have limited side effects and note it is available as a dietary supplement, including a special high-purity, expensive version called Raxone, which has been used in clinical trials.
People will ask about cost because cost becomes part of the burden.
The resources acknowledge that many people with MIT choose not to take supplements because they cost too much, especially when income is limited or multiple family members are involved. They report that some community members have said Raxone can be purchased online as a supplement at a cost of about 5,000 Australian dollars per month. They also note that in some instances, it may be provided through a special access scheme through a medical professional.
And what about safety?
They describe Raxone as considered safe and well tolerated for many people, with main side effects related to the digestive system. They also share that, in a study they reference, some people experienced side effects, and some stopped because of them, and they note that serious or severe side effects were not reported by more than 10 people. The key takeaway remains the same. Talk with your health professionals, because this is not a one-size decision.
There is also a regulatory angle here, right?
Yes. The resources state that Raxone does not have approval from the Therapeutic Goods Administration and is not recognized as a treatment for any type of mito. They also note it can be bought online where it is sold as a dietary supplement. That combination, high cost, plus not being recognized as a treatment, is exactly why the talk to your health professionals first message matters.
Okay, now the big buzz phrase, gene therapy. People hear it and think fix.
Gene therapy is described as an advanced treatment that involves inserting healthy genes into a person's cells to replace changed or missing genes, aiming to correct genetic conditions at their source. For LHON, the resources describe gene therapy using a virus called an adeno-associated virus to deliver a healthy version of the gene that is changed in people with LHON.
That sounds intense. How does it actually happen according to the description?
They describe that in LHON, the gene therapy is injected directly into the eye. The virus carries the healthy gene into cells so they can produce the correct protein needed to function properly. They also describe that clinical trials are underway to determine if gene therapy can help restore vision or prevent further vision loss by addressing the underlying genetic condition.
Is it available here?
The resources say gene therapy for LHON is still in the clinical trial phase and is not widely available. They encourage people interested in participating in clinical trials or accessing these treatments to consult with their health professionals for the most up-to-date information and potential options. They also note that vision improvements have been variable and more research is required, even though safety data in trials has been promising for many people.
So this is a watch this space, but not a book your appointment tomorrow.
Exactly. And the resources are clear that there is currently no gene therapy approved for LHON, so no price is available for an approved LHON gene therapy. They do mention that the only approved gene therapy for an inherited eye disease is for a different condition, and it is priced extremely high, which gives a sense of why access and cost questions are part of the conversation.
If treatments are limited, it makes support and participation in research feel even more important.
Yes, the LHON resources talk about clinical studies, and they describe clinical trials and research studies as essential for developing new ways to prevent, diagnose, treat, and cure Mito. They also point to joining the Mito registry to stay informed about opportunities to take part in clinical studies that are relevant to you. And they mention a separate Participate in Clinical Studies resource for more information.
What is the Mito registry?
The Mito registry is described as collecting information about people with Mito, with a main goal to improve access to research studies and bring clinical trials to Australia to better understand Mito. The eligibility described includes being a resident of Australia or New Zealand, and either waiting for a diagnosis of Mito or having a diagnosis. They also emphasize you do not need a confirmed diagnosis to join if you or a family member might have Mito, and that joining can help with access to relevant clinical trials and emerging treatments.
So it is partly about being visible to research.
Yes, and about building the knowledge base. Now, earlier we said we would come back to genetic counselling, because LHON is both a personal experience and often a family story. Genetic counselling is described as providing information about genetic conditions like Mito, including how they are inherited and what it means for you. It can help you make decisions about healthcare and personal circumstances.
Who does genetic counselling? Is it always a genetic counsellor?
The resources describe a genetic health professional as possibly a genetic counsellor or a clinical geneticist. Genetic counsellors are described as university-trained health professionals who help families with genetic conditions, like Mito, by providing information and support. Clinical geneticists are described as specialist medical practitioners who work alongside your care team to find a genetic diagnosis for a family. Social workers may also be part of the genetics team, collaborating with your care team and support groups to provide emotional and social support.
What does an appointment actually involve? People worry it will be judgmental or overwhelming.
The resources say consultations are tailored to individual or family needs and typically involve discussing genetic testing and potential results, discussing information about the specific type of Mito affecting your family, gathering details about immediate and extended family to draw a family tree, identifying people who may be at risk, assessing risk of passing Mito onto future children, and discussing reproductive options and testing options during pregnancy, offering support and advice for the adult or child affected by Mito, assistance with decision-making, and referrals to support groups.
That sounds much more like guided problem solving than a lecture.
Yes, and it also includes practical access steps. To get genetic counselling, ask your doctor or another health professional for a referral. Genetic services are available in public or private health systems. And requirements. Eligibility, wait times, and fees can differ, so you can inquire with your local clinical genetics service.
How does genetic testing fit into this, especially for Mito?
The genetic testing resources explain genetic testing as a way of finding typos in genetic instructions that could lead to disease, and they list types of tests including whole genome sequencing, whole exome sequencing, and mitochondrial genome sequencing. They also describe that changes in both nuclear DNA and mitochondrial DNA can be detected by certain testing approaches. They note that in Australia, whole genome sequencing of nuclear DNA and mitochondrial DNA is subsidized by Medicare, and that this kind of testing is the type most likely to find a genetic change if a person has Mito, though even it can sometimes not find a genetic change known to cause Mito.
That last part matters. A not found result does not always mean nothing is going on.
Exactly. And the resources also say genetic testing is usually ordered by a specialist doctor, not a general practitioner, and that Medicare funding is usually available for tests ordered by a specialist doctor. They also recommend gathering as much information about your family history as you can before seeing a specialist or genetics service, because it can help health professionals work out what type of Mito may run in your family and who may be at risk.
This is a lot. Can we bring it back to the person who is listening right now, maybe newly diagnosed, maybe still searching?
Yes. Let us translate the big picture into a grounded, what you can do next moment, using only what is already in these resources. If you are experiencing changes in your vision, the LHON resources point you first toward eye care. Visit an eye care provider, share your medical and family history, and follow referrals for comprehensive examination. If LHON is suspected, Genetic testing may be arranged from blood or saliva samples, and genetic counseling is emphasized to help you understand results and what they mean for your family.
And while you are in that waiting period, you are not supposed to just sit alone with fear.
Right. The resources describe immediate support options. Vision rehabilitation organizations can help with orientation and mobility training, maintaining independence at home, school, work, and in the community, and technology assistance. The helpline is positioned as a way to connect with services in your area and to get advice about supports, including the NDIS.
Then there is the NDIS pathway, which can feel like a second full-time job.
And that is why the NDIS navigation service exists. Free and independent support designed for people living with Mito, helping you understand how the NDIS works. Identify goals, collect supporting evidence, apply, prepare for planning, and understand decisions or challenge them if needed. If your vision impairment is caused by LHON, the NDIS Assistance Information Sheet adds practical steps like third-party consent, voicemail updates, and requesting contact details from callers, as well as the importance of a strong ophthalmologist letter.
So a practical next step could be ask my ophthalmologist for a letter and use the template.
Yes, it gives a structure for that letter. Diagnosis, permanence of vision loss, details like visual acuity and visual field, information about both eyes, the lack of proven cure, functional impacts on driving, work, study, and daily activities, and potential supports such as allied health assessments, assistive technology, orientation and mobility training, home modifications, and support worker assistance for transport and community access.
What about things people can control day to day without turning it into blame?
The resources frame this carefully as risk reduction and general well-being, limit alcohol and avoid smoking because both can increase the risk of vision loss. They also mention maintaining a healthy lifestyle, balanced diet, staying active, and using eye and head protection during sports and recreational activities where possible, and avoiding high-risk activities like boxing. And if you are at risk, check with your health professional before taking medications, because some prescription medications may be problematic and benefits and risks should be weighed with professional guidance.
That feels like a respectful way to say you still have agency without pretending lifestyle is a cure.
Exactly. Another next step, especially if you are someone who wants to help future options move forward, is research participation. The resources encourage joining the Mito registry to stay informed about relevant clinical studies and trials. And if you are curious about emerging treatments like gene therapy, the resources repeatedly point you back to your health professionals for up-to-date advice, because these treatments are still in clinical trials and not widely available.
And social support matters too. It is not just medical.
Yes. The LHON resources include support groups, including Australian-based and global Facebook groups related to LHON, and they list a range of low-vision community support services. Even if someone never joins a group, knowing they exist can reduce the sense of isolation. And the care team list includes mental health professionals, which is a quiet reminder that emotional well-being support is part of real care, not an afterthought.
Before we wrap, I want to make sure we have not lost the human side. There was that short personal story earlier.
Yes. The LHON resource includes a personal story from an adult whose eyesight began to fail as fogginess in one eye then moved to the other. Stories like that are not there to scare people. They are there to say, you are not imagining this, and you are not alone in how strange this can feel.
Okay, let me try to reflect back the core message in my own words. LHON is a type of mito that often causes sudden, painless central vision loss, usually starting in one eye. It is linked to genetic changes in mitochondrial DNA and is inherited from the mother, but carrying the genetic change does not guarantee vision loss. There is no cure right now, so support and adaptation are central. And there are pathways like vision rehab, the helpline, and the NDIS navigation service that can help.
That is a strong summary. And I would add one more thing. When you hear about treatments like LHON or gene therapy, the resources encourage cautious, informed decision making with your health professionals because evidence is still evolving, access can be limited, and what is right for one person may not be right for another. Meanwhile, practical supports, clear documentation, and connection can make day-to-day life more manageable.
So, closing thought, if someone is listening and feeling overwhelmed, what is the first small step?
If you are in the thick of vision changes, start with eye care and ask for referrals. If you are drowning in paperwork, contact the helpline and ask about the NDIS navigation service. If your family is full of questions, ask your doctor or specialist for a referral to genetic counseling. And if you are looking for community, consider exploring the listed support groups and low vision services. You do not have to do everything at once.
You've been listening to MitoCast by Mito Foundation. To learn more or find support, visit mito.org.au or call our helpline on 1300977180. Make sure you follow MitoCast wherever you listen to this podcast to help us spread the word by sharing it with others impacted by Mito. Thanks for listening.